Heavy metals and mycotoxins are some of the biggest that I see that pop up that make a huge difference and also are the most impactful when it comes to symptoms a client that is experiencing. You can see it pretty quickly with people that have a lot of high heavy metals or high mycotoxin exposures. They are the ones that it's a big needle mover once we address those.
Hello and welcome back to the Vibrant Wellness Podcast. I'm your host, Dr. Emmie. Today, we have the pleasure of welcoming Macy Coleman. Macy is a board-certified registered dietitian, nutritionist, and women's health, hormone, and fertility aficionado. She's the founder of Well Woman Nutrition, a virtual practice rooted in functional and integrative nutrition practices that focuses on full mind and body wellness. Having struggled with hormonal issues of her own, she eventually realized that what was happening to her was actually happening for her. After all, what better way to walk another woman through her journey than to walk with her? I can't wait to learn more about Macy's personal health journey and unravel the hidden causes of infertility in today's episode. Macy, thank you so much for being here.
Yeah, thank you for having me. I'm really excited about this topic to dive into.
Me too. And before we do that, I would really love to touch on your personal health journey and how this led you to the work that you're doing today.
Yeah, absolutely. So my own health journey really began like in college, high school, college. I was navigating a long list of chronic symptoms, mostly digestive, but definitely some hormone imbalances along for the ride. And really no one seemed to look deeper into it. I found myself like in and out of ERs all the time. I was just mostly collecting longer lists of diagnoses and more prescriptions and just not getting any closer to healing. And just they kept telling me things were normal or common for someone your age, right? Like, oh, you don't need a gallbladder. And while we're in there, we'll take out your appendix, even though you just have stomach aches and there's nothing wrong with it. A lot of people your age have that issue. But I knew deep down, nothing about how I felt was normal. So I just became really determined to find better answers. And that's when I discovered functional medicine, not only as a patient, but then eventually as a practitioner. Really just started learning everything I possibly could, reading loads of books, listening to podcasts, and experiencing things myself. I started actually experimenting on myself and taking advantage of training. I sought mentorship from some of the best minds in the space. Really what started as kind of personal desperation turned into professional purpose, which I know is a lot of people's story that hang out in this functional realm. So today I get to lead a really great, thriving practice that's now helped thousands of women just really reclaim their health. And especially now that I focus on fertility, I'm able to help bring miracle babies into the world. And that's really the most fulfilling work I've ever done. Of course, second only to being a parent myself. But again, if, as you mentioned earlier, what greater way to walk someone through a journey is walk beside them and have a lot of similar shared experiences.
Absolutely. And I'm curious, Macy, were you interested in health and wellness prior to your own personal experiences?
Yeah, I remember.
Was that the plan all along?
No, kind of. I was in high school and I'm from a super, super small town, like 800 people. So the only jobs we knew about was like you're a farmer or you're a police officer or you're a teacher or a doctor. And I was reading a health and fitness magazine one day and I saw them call out a dietitian and kind of explain what that job was. And I was like, I did not know like focusing on healthy food would be a job. And I was talking to my mom about it. And she's like, I think I know someone who is a dietitian who's a family friend. So that got me connected. And yeah, I was probably like a freshman in high school. So I did know that I wanted to be a dietitian. But as you are probably familiar with, there's a lot of different types of dietitians. And there's definitely some conventional based dietitians. I started out in clinical, and that's what I thought I loved. But it did take me time and experience to kind of niche down into functional medicine and definitely into women's health. But health in general was always the plan.
Right. Okay. Got it. Yeah. Sometimes we see these huge pivots for professional goals, and but this is something you were always interested in. But then you were really focused on fertility, as you mentioned. So how did that come about?
Yeah. So interestingly enough, like niching down into what I found most fulfilling became fertility and helping women, because really my mission and my practice is that no one who comes to me leaves feeling dismissed or without a path forward, because that's how I felt in my journey. I just really try to meet all of my clients with a lot of empathy, curiosity. I think that curiosity makes the best practitioners. And just like I have this relentless like drive and commitment to finding answers for people. So part of a long-winded way to answer your question, I went through some experiences myself. I experienced a pregnancy loss, so I do understand that kind of like earth-shattering, devastating grief, and then really the resilience that it takes to keep going. So it has made me a really more of a compassionate and effective partner to my clients' journey to parenthood. But even in my other experiences that are non-fertility based, it's not a one size fits all. It's not, gaslighting people. It's like really understanding, getting curious about what these symptoms are or why this person's experiencing it, and just be in the passenger seat in their journey and give them answers that they like desperately are searching for and they truly deserve.
Hmm. I'm wondering also, do you have clients come to you and say, I'm feeling good, and maybe I haven't even started to try to conceive yet, and they want preconception care? Because I'm sure there's a huge overlap between your work that you do with clients struggling with fertility or infertility, however you want to say it. I like to say, maybe we can focus on fertility, right? It's the kind of the glass half full, which is what I'm all about. But are you working with people who say, like, well, I don't think I have any issues, I don't know, but I want to work on preconception care, which is just a phrase I like to throw out there because we don't talk about it enough?
Yeah, and that's a good question. I'll be honest, I did a lot more of that at the beginning, and I don't know if it's just the type of clients that I work with now and this word of mouth spreading about, like, who has had success working with me, but I would say 90% of my caseload is fertility, and probably 80% of those, women have really been around the block and have, a lot of cofactors in this, and they have been on the journey, and a lot of them have been through like a lot of failed conventional fertility treatments, IVF, IUIs, maybe have been along trying to get pregnant in their journey for 10 years even. So I see a ton of really complex
Mm,
cases now. I'd love to see people that are here for preconception, because it's the most impactful and so important. And I did a lot of that before, but I have created a course I'm sure we'll chat a little bit about later, but that does lay the foundations and get people into that preconception health space and mindset, so that they have a good starting place so that they can check all those good foundational boxes.
yes, I love that. Yeah, I mean, and I think some people just don't realize that we do need to be more proactive, maybe start thinking before we run into issues. But on that note, if there are issues or roadblocks, I want to know, let's just jump straight into it, root causes of unexplained infertility that you see most commonly in your practice, and maybe highlight a few of those that you're seeing most commonly.
Yeah, I feel like the biggest ones I see stem a lot from gut health issues. So we see a lot of like infections and inflammation from the gut. We see a ton of immune dysregulation, and we know that most of the immune system lies in our gut. So we can retrace that, back to gut health. I see a lot of adrenal and hormonal dysfunction and imbalances. We see women that are struggling with like poor blood flow, like systemic blood flow to get those good nutrients and get that good oxygen to the ovaries and to the pelvic region, to support, healthy implantation and growth and a healthy pregnancy. And then I also see a lot of high toxic burden. I feel like everyone's kind of aware of how toxic our environment is now and continues to be. So
Yeah.
we do see quite a bit of that. And then my other one would be probably not nourishing women that are not nourishing their bodies properly, maybe not with enough nutrition. I find a lot of people are accidentally under
Mm.
eating or just struggling with like the right types and amounts of food to support healthy hormones, their gut health, and a pregnancy.
And I want to dive into, maybe a couple of those later on, but what about any early symptoms or patterns that people should be paying attention to, women in particular should be paying attention to that might hint at deeper root cause issues? Because I think sometimes a lot of people maybe deny GI concerns, or they don't know, they have a normal, they have,
Yes.
this is their normal, but they don't realize that there may be an issue with their normal. So what kind of in particular for your fertility patients, what patterns are you seeing clinically?
Yeah, I that's a good thing to point out is oftentimes if we address using your example of the gut, if we address the gut based on the labs that we see come back, they're like I tell them these certain things can cause bloating or whatever symptoms. They're like, I don't experience that. And then we treat it and they're like, wait, I've been bloated for 20 years of my life and didn't realize it. Like that's gone away. Like that's,
Wow.
that's crazy for so many people. And I see that often. But honestly, it's going to be a lot of symptoms that people generally complain about: low energy, brain fog, frequent illness, digestive issues, or classic stuff like constipation or diarrhea. A lot of people don't understand we need to have 1 to 3 healthy bowel movements a day, and that's good gut health. We don't want to see any bloating. We don't want to see, people feeling tired after meals or other digestive issues or things coming from the gut, which could be like skin issues like acne or rosacea or eczema or
Hmm.
sleep or recovery from getting enough sleep or recovery from exercise. And a lot of just like heavy PMS symptoms or low libido, even.
Hmm.
A lot of people got stuck with like stubborn weight loss resistance or weight gain. We know that there's, anytime we talk about weight, it's never, the root cause issue isn't the weight, right? It's like something deeper, something else is driving your inability to lose weight or why you're gaining weight. Your body just doesn't feel safe. Something's going on there. But then you think about just irregular cycles or light or heavy periods and everything associated with that. These are all just signals that the body is struggling. So these signs show up oftentimes before labs start to change. They're basically, think about what symptoms are, right? They're the body's way of asking for help. And it's the clearest way it can communicate with us. It's just us having enough body literacy and enough support, right, from a good practitioner to understand, like, hey, what your body is actually saying. You're responsible for figuring or for understanding what those symptoms are, but then when you share them with someone who has the tools to kind of put the pieces together and say, okay, well, this might be what's driving those symptoms. So it's teamwork, but a lot of the stuff we classically hear people complain about are big patterns and symptoms that can tell us there's something deeper going on.
And I'd be remiss if I didn't mention the male counterpart. It takes two, of course. So I wonder, are you meeting with couples, Macy, and discussing maybe any fertility issues in terms of males?
Yeah, good question. So I work one on one with females only. However, we do address so many lifestyle, dietary, supplements, environmental changes, nervous system stuff. And a lot of that is across the board, right? Like anyone can eat a healthy, balanced diet. Blood sugar matters for everybody. A clean environment is supportive for both the male and female. So I love when the male counterpart jumps in on our calls and listens and supports and also makes big changes with their significant other. So they're always welcome to make those healthy changes. I do lab tests with males. So like any of my mini package, so all my functional labs I will do with males because yes, they're absolutely part of the equation. And even though I'm well women nutrition and I focus on women's health, exactly, I would be crazy to not be able to put all the pieces together. And so I will absolutely make notes of, hey, I think we should look at this, or, I think your significant other should go and maybe get like a hormone workup or do something in that way. But yes, absolutely huge piece of the puzzle.
Right. And I imagine a lot of the lifestyle recommendations apply to both. I mean, you touched on toxins a little bit. So, and there's a lot of tools out there and apps that we can use to find healthier personal care products. I'd love to hear what are some of your favorite resources as far as identifying low tox or no tox products, and also kitchen cookware type products. I'm always interested in finding out the best cookware, because there's so many toxins that are hidden in not just the bathroom but also the kitchen.
Yeah, yep, absolutely. I have a couple apps on my phone. I like the Clearia app is one that I have used frequently. There's another one, I think it's called Olive, that's a little bit more food based. That's really helpful. I do follow a lot of accounts that really look through labels and teach me about some of these like new chemicals and new additives, because it's so hard to keep up in that space, that I do look for to other professionals who specialize in it to kind of keep up with that latest research to share with us. But it does make a huge difference. One thing, I was actually just having this conversation with my mom yesterday when we were talking about some health stuff, that like health trends, and she was like, "Oh, it's so overwhelming, all the things." She was basically, we were talking about oat milk, and she was like, "I heard oat milk's
Mm.
bad for you." So then we get into this deep dive conversation about it, and I kind of told her, I'm like, any change is enough. Like if you make one change, it's going to be helpful. And I see it all the time with clients that I do, like the total toxin burden test. I do all the time with a lot of my clients, and you can see what their lifestyle is like by those tests, and they'll verify like, no, maybe
Yes.
organic produce isn't, important to me, or I haven't made changes in my environment yet. And it's like, it's so clear. And the people that do make even a little bit of effort, right? It shows, and it's impactful, it's powerful, and it does make a difference.
Hmm. Yes, I'm glad you said that, because I look at so many of those reports also, that total toxin. And it's purely anecdotal, but I do feel that I can somewhat gauge the education level as far as the low toxin personal care products. If I'm seeing more paraben and phthalate, I think
Yes.
maybe they need a little bit more education there. And so I think that's fascinating. A lot of the healthcare practitioners are using the tests on themselves to learn it, and I see a lot less of those for those folks who are more well aware. So I think that's fascinating, and I'm curious if you've noticed, of course everybody wants kind of a magic bullet, and I know that doesn't exist, or maybe they want to attribute issues to one thing, and that just is very, very rarely the case. But is there a toxin category, or maybe a few that you've seen really kind of make a difference in terms of endocrine disruptors for your clients, whether it be paraben, phthalate, BPA? Kind of, what are you seeing in your experience when they make those changes?
So, heavy metals and mycotoxins are some of the biggest that I see that pop up that make a huge difference, and also are the most impactful when it comes to symptoms a client that is experiencing. And then I find once I love and hate to use the word detox because it has such a bad rep sometimes, but truly, when we help detox them, we lower the toxin load from the environment, but also just help their body's hardware get rid of what they're holding on to. Those make the biggest difference. You can see it pretty quickly with people that have a lot of high heavy metals or high mycotoxin exposures. They are the ones that it's a big needle mover once we address those.
And we know the mycotoxins can be endocrine disruptors. I'm not as familiar with the heavy metals and hormonal disruption. Can you speak to that a little bit more? And mycotoxins too. I'd love to know just any pearls there.
Yeah, honestly, the when I see a lot of mycotoxin exposure, I know that there's something in the environment, of course, but something going on with the liver. Like, why is there stagnation? Why are we holding on to this stuff? And so, when we really, again, address the body's hardware, our ability, we always think about the sink and a clog in the drain, right? The sink, the faucet is what is your exposures, and then the drain is your body's ability to move things through. And if it's clogged, we're going to see backup. So I just want to mention that the biggest thing there is, yes, eliminating those exposures or decreasing, but it's making sure the body can get it out. And even if we focus just on that, we are going to see improvements. When it comes to mycotoxins, typically when you see one, you see patterns and where they're coming from, whether they're environmental, like water damage building, or they're more food-based molds. So we do talk about molds and fungi. We do talk about a lot of good hygiene with food, like rinsing rice or soaking it, sprouting grains, getting organic when you can, things like that, really high quality options, and making adjustments based on the patterns that we see. And then when it comes to heavy metals, that's less often that we see that, especially just in practice when we're looking at a total tox burden, but we do see it. And typically, again, people that have one have a buildup of more. We look to their water source quite a bit to see where that might be coming from, those exposures.
Yes.
But heavy metals cause a lot of like neurological stuff, is what I see most often in my practice. But it does also negatively impact egg quality quite a bit, but we don't have a measure for that. We do have more of a measure for sperm quality. So we see a lot of that going on too with heavy metal exposure. So typically when I see my female clients with a lot of heavy metals, we know that there's probably their male counterpart doesn't have the best looking semen analysis, and we likely know kind of what's the culprit there. So we definitely are addressing the hardware, but also the exposures, and we see a lot of patterns.
That's fascinating. Yes, I'm so glad you said it that way, because there could be something structural or chemical or inflammatory otherwise. Um, and this is a question that I think a lot of listeners are wondering about. And to your point, the word detox, right? This is something that we do every day physiologically. So I like to say supporting detox. But when is the best time to support detox? Let's put it that way, before trying to conceive? Or is it maybe too late once you're trying to conceive? Or, I mean, I've even had cases where they have conceived and now they're talking about running a total tox, and it can be a little sticky at that point. So how do you approach that?
Absolutely. And there's always going to be tiers to everything based on the client, based on their exposures, based on their abilities, based on their symptoms. So if someone came to me with a total tox burden or wanted to take that while they were pregnant, we'll just start with that. That's their prerogative to know about their health. So I'm definitely willing to do that. What we would focus on is like, hey, is there some exposures that we can reduce, or are there food sources that will help your body's ability to detox? We just think about the liver first and foremost, right? There's so many good foods for the liver, cruciferous veggies, high quality antioxidants, really rich in good animal proteins that are rich in B vitamins to help the phases of liver detox. So we would probably take a more food-based approach in that case. But if I had my perfect way, I would love to see people spend 3 to 6 months focusing on more detox and then giving it another 3 months afterwards to kind of repair and heal and calm everything down, support the nervous system. Because if you think about detoxing, if you really get after it, it shakes up the body a little bit, and it shakes up the immune system because we're having to put a lot of work there. So I like to spend some downtime afterwards, just restoring balance and calming everything down, because it's not ideal to create an embryo when there's a lot of free floating toxins that we're trying to that we've mobilized and now we're trying to get out from the body. So two different cases, right? If we could start way earlier before trying to conceive, that is super ideal. But it doesn't mean you can't do anything if you are actively pregnant.
Well said. And then I'm also wondering, kind of, when you are in that ideal scenario, when you have time to prepare, what are your go-to products and maybe strategies to support detox? And this is, and kind of, we're just speaking generally, but maybe in regard to, maybe there are several mycotoxins and heavy metals and environmental toxins that we're concerned for, in particular. I'm not going to throw in gut infections. I don't want to complicate things too much, unless you want to get crazy with a particular case, but
Yeah.
we
Yeah.
can keep it
So when
simple.
anytime it comes to, we're talking about detox, it's always about opening drainage drainage pathways. So I always think about the
Yes.
body working. We have multiple systems. Every single system can be closed off with a door, right? These doors are all shut. The ideal scenario is that we open all the doors so we can get things out free flowing through the body. The kind of way out is going to be mostly through stool, mostly through the gut. So the gut definitely has a huge part in this. And then also through the kidneys, right? So urine, the bladder gets rid of a lot of stuff. So those are two big pathways. We want to have those opening and free flowing. We think about lymph, the lymph system that holds on to a lot as well, the bile ducts, the gallbladder, the liver, all of these places where we process toxins and just move them through these stages and ideally open these doors so we can ultimately get them out of the body. The biggest issues I see in clients by far when we're talking about detox is that they have some of these sluggish systems that aren't open, the doors close, right? So if we start detoxing with like supplements, typically food stuff tends to be well tolerated. But if we bring in some of the big guns and more of the direct detox supplements, I like to use a lot of cell core stuff. That's not the only thing I use, but they do work pretty well. And they're mostly, their product line is pretty potent. So that's going to, when I say bring out the big guns, those are the ones I'm thinking of. So if we just start killing parasites or detoxing without first opening those drainage pathways, people feel really awful. And a lot of people have, again, those sluggish pathways. And so essentially, I find that people that have tried to detox in the past that have maybe not, done it correctly, they're just retoxifying themselves because if you can't get it out, you just reabsorb it and you feel worse. So making sure like that is the first step. We are focusing on drainage. There's really easy ways to do that. Again, always supplement assistance can be helpful, but you can utilize things like dry brushing for lymph support or rebounding or putting your legs up against a wall. You can use saunas or, cold showers. You can rotate between hot to cold, hydrotherapy. You can do Epsom salt baths. There's just so many good things that you can do that are free to help these drainage pathways. So I know I am harping on that, but truly that is like the biggest thing. If we can just focus on that, the other stuff is a lot easier. And then we can bring in very specific like herbs and botanicals to pull and kill, whether that's heavy metals we're looking at or parasites or mycotoxins or mold. We can get really specific after that. But first step is drainage always.
So I do want to move on. There's just so much to talk about here, but Macy, the vaginal and uterine microbiome, I don't think we talk about this enough. And so I'd love to talk about testing the vaginal microbiome, implications, infertility, anything that you find interesting here or useful. I'd love to hear it.
Yeah. So I think that this topic this area is just such a vital area, specifically for fertility, that has been historically ignored, whether that is honestly by research, because we didn't know so much about it and now we do. And I think that's what's so fascinating and so cool that like the research is catching up very quickly. And we're putting a lot of effort into exploring the vaginal and uterine microbiome. If you think about high level, why this impacts fertility, well, think about the vaginal tract. And really it's welcoming. It's like the welcoming committee for sperm. So that's really important. And then the uterus is the home for the embryo. So those are super impactful when it comes to making a baby, supporting, nourishing an embryo, and creating, sustaining a healthy pregnancy. So if either of those are inflamed or harboring infection, implantation becomes nearly impossible. And we can see some early losses associated with it as well. The testing, as it kind of evolves, we know that these environments are not sterile as they used to be thought. Actually, one of the more recently, I would say probably 2 years ago, I was going over a test with a different company, a hormone company, and the provider was like, well, anytime it comes to fertility and we're talking about the uterine microbiome, it's a completely sterile environment. She was like, kept talking about how sterile it was. And I was like, what? This seems odd because there's only a cervix, right? Like if the vaginal tract isn't sterile, how can the uterine environment be? So
right.
I kind of focused on that a little bit early because that just kind of stuck with me. And I still am like, wow, that wasn't very long ago that people are still, thinking that. So there are now testing options because that's not true. Through you can get some through your OBGYN or your fertility providers in office, or the cool thing is that there's several direct to consumer options, whether it be the vaginal microbiome or even the uterine microbiome. That's also available and very valuable. The one thing I do want to mention, though, about this is it's an emerging field. It's awesome that more people are focusing on it now, but I feel like there's still a big piece of it that's missed by a lot of providers that are adopting this. And it's the male
Mm.
counterpart. So many times we're doing these tests, we're seeing these women that have these infections, we're treating them, and then these male partners, they're overlooked. And we know that seminal fluid can harbor pathogens and they can just reintroduce them, right? When we're trying to conceive, back to that uterine environment, back to that vaginal tract. So that leads to a lot of kind of like persistent or reoccurring infections that I see all the time in clients. So making sure we're assessing both or treating the couple really as a unit is essential for success for really balancing both of those environments.
And I'm curious, Macy, it goes beyond your typical vaginal infections like Candida and BV, right? We're talking about organisms that are lesser known
Yeah,
that can be
absolutely.
connected to issues. Of course, those things are picked up routinely. So it's not those infections. It's not necessarily STDs. I mean, that's a whole nother ballgame we could talk about. But you're talking about more so commensal vaginal. I mean, I'm sure that there are some, like you said, some things that are still being discovered, but some commensal organisms that can cause issues in particular individuals. Am I thinking about that correctly?
Yes, absolutely. So ones that I see a lot, Gardnerella is a huge one. I see that frequently. We know that there's research to show that it basically stops implantation from happening if there's an infection present.
Wow.
Obviously, we're not speaking 100% here, but it absolutely is one of those root causes of implantation failure. So that's huge because that's been studied actually in IVF, I believe, was the research around that. So that's just one example, but ureaplasma, there's many others, but yes, that is beyond the normal BV, beyond the yeast infections, but also a lot of these are kind of go under the radar because there's not a lot of symptoms associated with most of them. Sometimes we get like classic BV. That's what I see most often if it's symptomatic. But a lot of people are asymptomatic that have these really imbalanced vaginal or uterine microbiome. Maybe the only symptom is infertility. I do see that often too.
Great point. Yes. And I'm glad you brought up ureaplasma because that can just be baffling for people. It can be immensely frustrating. I've seen that in practice where they're dismissed by practitioners because they say this is not technically an infection, or they say it's not technically an STI, but you can get it from a partner. And
Yeah.
you're saying you've seen that cause issues in your fertility patients.
Absolutely. Yes. And again, treating both partners or at least assessing both partners to see what's going on because I see people that have these infections. They're really excited that they finally have an answer for things. And then their their provider treats it maybe with an antibiotic and doesn't think about supporting, right? That's just too much killing and we're not replenishing or supporting. We're kind of missing an opportunity there that can make that reoccur, but also that introduction to our male partner who may be carrying that same infection and just kind of sharing it back and forth if we don't really tackle both
Right.
of them.
And something you just said there, I want to pull on that a little bit in terms of not just focusing on antibiotics or antimicrobials. That's a piece of it, but ureaplasma, my understanding, is a commensal. So you have these cases where someone is symptomatic, whereas, a lot of other individuals, they never get tested. It's never an issue because they've never had any symptoms associated with it. So I'm wondering about kind of background risk factors as far as those foundational pieces. I imagine I'm sure there's different things as far as vaginal health that you speak to clients about, but what do you think predisposes certain clients to having vaginal dysbiosis is I guess what we're talking about here.
Yeah, so I am in contact with a lot of clinicians that work for some of those companies that do direct to consumer testing, and they're brilliant and they share so much good information. And the recurring conversation that we have is treat the gut. Something's going on in the gut. If there's something
Mm,
going on in the vaginal tract, it doesn't always, it's not like a one to one mirror image by any means. They're very, very different because what we promote in the GI tract is a lot of variety, right? Like lots of microbes, lots of variety. What we promote in the vaginal tract is very limited variety. We're really looking just for lactobacillus species there. So it's definitely different. However, if there's dysbiosis found, we always are still looking to the gut to see what could be going on there, what's going on with our immune system. I would say if there's anything we're going to talk about here, it's going to be what's going on with the immune system. Why do we have an infection? Why is it chronic? Why is it recurring? Why can't our immune system do what it's supposed to do and fight this off and help us heal and kind of keep it at bay in a way and not allow us to continue to live with that infection or get reinfected? So the gut and the immune system are two big players in that conversation.
absolutely. And I'd love to hear how you support the immune system because there's an artistry to this. There's really no right or wrong. Of course, if we're talking like really just high level basic, we want to know vitamin D levels, we want to monitor this, we want to supplement when necessary. But what else are you doing to assess and manage the immune system
Yeah. So
and
with
really
the immune
optimize
system,
it?
yeah, good question. I if we're talking about some lab tests, I like to look at like ANA. So this is going to screen for your general autoimmunity, kind of help identify if the immune system is attacking healthy tissues. I love looking at a secretory IgA. We're going to find this on a stool test. So this is a marker of mucosal immune health. It reflects that gut immune function and chronic stress because we do see that secretory IgA has an inverse relation with stress. If stress is high, we can see secretory IgA go low. But this is a time to point out that the gut has everything to do with the immune system. So I'll kind of loop back to that. Specific antibodies we can test, there's loads of them. But maybe just a couple examples would be like antiphospholipid antibodies or some antithyroid antibodies or anti-ovarian antibodies. These really just help kind of detect and pinpoint immune system attacks on more like fertility critical tissues like the ovaries, the thyroid, and blood vessels. More specialty testing. This is very nuanced. This isn't something I order, but I do look at them, look at these types of tests from mostly like reproductive immunologists, but we can see some NK cell and cytokine activity going on. That's a way to kind of assess the immune system ability to tolerate an embryo versus potentially attacking it. So those are some things that can give us more insight into what's going on in the immune system. But honestly, I think I heard this somewhere and definitely don't quote me on it, but I think someone was saying like essentially we only know about 10% about the immune system. The immune system is so vast and
Mhm.
so
I
complex
believe it.
that we're truly just scraping the surface, and especially when it comes to fertility, which is why you see kind of across the board when there's a lot of immune system dysfunction. I see a lot of whether it's reproductive immunologist, someone in the conventional fertility realm, we're going to just shut down the immune system, right? We're just going to give like high dose
Mhm.
steroids. We're just going to turn it off because we're like, we don't know how you act. We don't really know what to do with you. We don't really know what's going on here. So we're just going to tame it all down. We're going to quiet it so it's not attacking, these embryos, and we're allowing this embryo to grow and thrive. Because if you think about it, an embryo is only half self, right? It's got DNA from your partner. So we want to make sure that the immune system is able to be robust enough and not out of control so that it can recognize that and it can kind of decrease its or increase its tolerance essentially to allow that to grow and thrive instead of attack it as like a foreign invader. So there's a lot with immune system dysregulation and fertility that we have to consider there. But anytime there's an autoimmune condition present or any of those things I just mentioned flagged on a lab test, I'm always looking to the gut first and foremost because we know, again, that's where most of that immune system is. We know we can make such a big impact if we're healing and sealing that gut lining so that we can protect that bloodstream and not allow endotoxins and pathogens and things to get through there and mount those immune system responses. So that's definitely the number one place I'm starting. And then we'll kind of go from there based on what else we're finding.
What about probiotics? Because there are vaginal probiotics, of course, there are oral probiotics. And while we're on the topic of the gut, what are you using, and maybe even specific probiotic strains and the route of administration that you're really liking right now to support fertility?
Yeah. So I want to first say, I feel like not a lot of people feel this way, but I, if I don't have test results or if I don't have a very specific situation, I am not one to recommend that everybody take a probiotic. I think that if we
That's fair.
don't know
We love
what
hearing that.
yeah, it's not what I used to. Years ago, I used to say everyone needs to be on a fish oil multivitamin and a probiotic. But that's definitely now that I do a lot of functional testing, I do a lot of stool testing. That's not my beliefs anymore. I'm going to answer that question in a second, but I just want to talk about this for a second. So because we don't know exactly what someone may need if we don't have testing, if we want to be more general and support gut health and rebalancing, repopulating, I like to do prebiotics across the board. Of course, focusing on the diet and prebiotics from fibers that we're eating and making sure we're getting enough and getting good variety. I like to have a lot of my clients rotate through different types of prebiotic fiber powders as supplements versus actual probiotics so that we can kind of feed the masses and then we can switch it up every once in a while. So we're feeding different things their favorite food. So that's my perspective on probiotics to start. But when we have testing and we know specifically if we're talking about the vaginal microbiome, there's a lot of really good blends. One of them that I really like is I think it's Thorne Women's Daily probiotic that has a lot of good lactobacillus species in it that are really supportive to the vaginal tract. So that's a really good one. I will say that is part of this like emerging field of vaginal care and the vaginal microbiome in a nutshell is we don't have nearly as many, maybe not even like 1% as many supplements we can choose from, things over the counter to use for the vaginal microbiome that we do for the gut microbiome. So doing some compounding with compounding pharmacies is really helpful to get
Oh,
certain
yeah.
strains into like a suppository option, because looking at things like on full script or over the counter that are good species for the vaginal microbiome, the research says that we can't, when we take it orally, it doesn't do exactly what we want it to or as much in the vaginal tract as we would like. It's better if we do it localized as a suppository, but
Sure.
being over the counter, we don't have a lot of options there. So a company like Evie, if you've heard of Evie before, they do vaginal swabs at home, direct to consumer. They have a really cool like clinical program. So people that do that are able to utilize that clinical program to get compounded supplements from a prescribing provider to help give them exactly what they need to treat a vaginal infection or support the commensals there. So that's a really cool option.
Very cool. Yeah, I have come across them. I really like that service. And I hope we see more of that. And I'm also curious about, so I obviously vaginal local vaginal probiotics are going to be ideal, but I'm wondering, I've heard this years ago. I don't know if people are still doing it. I was always a little, skeptical and wary, but yogurt, like
I know.
plain, of course, we don't want any sugar, but like, are you ever recommending or do you have any comments on vaginal yogurt for probiotics?
I read a book by Aviva Ram. If you're familiar with her, she
Sure. Yes.
is in the hormone women's health realm, and she recommended it. I think she even has like maybe a blog post or an article out about it. So I have recommended it in the past, truly from she gives in some of her books, gives some protocols and things. So I have utilized that before. But now, if it's something like that, I'll just have them go through Evie or get a prescribing provider to compound something that I feel a little bit more safe doing. because yeah, we don't want to
Sure.
throw anything off. We want to be super specific about what's in there. And we know about yogurt is some of those strains of probiotics aren't alive and thriving or at the amounts that they say they are. So how big of a benefit are we getting? It's a little bit less known than a capsule that tells you exactly how many CFUs you're going to get.
Yep, yep. And messy to,
Yeah.
mention that as well. So if we can compound, absolutely use your compound pharmacists because they're awesome and they want to help. I've talked to several of them in my day and they're wonderful. So that's just a shout out for the compounding pharmacists. I'm sure you've had similar experience, hopefully.
I totally agree. Yeah, they're brilliant.
Yes. So we're coming up on time here, Macy, and this has been amazing. I would love to hear about maybe a case that's kind of at the top of your mind or one that was very inspiring for you or memorable, if you don't mind sharing a case study with us.
Yeah. So I'll actually talk about someone I talked to this week. A client of mine, she came to me after experiencing 4 consecutive pregnancy losses. She had tried so many different things, as one would in that case. So she was doing, when she came to me, she had tried like a strict autoimmune paleo diet, loads and loads of supplements, acupuncture. She even did surgeries for silent endo that she was experiencing. She did some medicated
Mm-hmm.
cycles. She was using, anytime she would conceive, she was using like progesterone. She had aspirin on board, injectables, things to help with that pregnancy. She also did extensive recurrent pregnancy loss testing through her conventional doctor, which was really nice to have. But honestly, there was no like big red flags on there. So she was kind of left in the dark. And so by the time she came to work with me, which was about a year ago, she was just feeling like really physically depleted, emotionally exhausted, desperate for answers, but also incredibly willing to like do anything at this point. So I asked her to stop trying to conceive, even though that's like one of the hardest things to hear when you're in a fertility journey. I was like, can we take a break? I need to focus really entirely on rebuilding your health from the inside out. Because she didn't want just another big fat positive, she wanted to bring home a healthy baby at the end of this. And that's what we focus on in my practice. It's not about how many pregnancies we can get, right? How many BFPs. It's really about the healthy person and establishing health and wellness from that root cause standpoint to then be given the gift of fertility afterwards. So the entire process was really, really difficult for her. But it wasn't, when she came to me, it became way less about even bringing a healthy baby home. We focused so much on her unique health and how she was feeling. And we were just so in alignment about that. Is like, your health comes first and then we give from there. So over the course of a year, we took a deep root cause approach to everything. We actually discovered mold in her home. Shout out to the total tox burden. We found a lot of mycotoxins present there. She was able to actually move to a healthier environment, which is amazing. We prioritized at that time clean air, clean water, a really nourishing diet. We stopped the restrictions. We stopped the autoimmune paleo diet. We brought in a lot of nourishing foods. We upped her intake of antioxidant rich foods, so those really deep colors. She did really well with that. We didn't actually run a lot of tests. She had had so many already. We just did a stool test for her. It revealed that she had a lot of low commensal bacteria, so low good guys, and a lot of signs of inflammation going on. So I knew the gut health, our immune system, all of that was key. Her immune system was really key in her story based on her history. So we basically went deep into gut repair, immune regulation, and detox. So what happened next did shock her, but made perfect sense to me. She actually began purging like loads of visible parasites for about 8 months.
Oh, wow.
We spent, and believe me, we did not just have a kill approach. We did a lot of supportive work during that time, but spent about 8 months purging parasites. Considering her environment, her history of mold exposure, right? Parasites are little toxin mops, her immune dysfunction, and the pregnancy loss. This was not a surprising revelation to me. Once her body felt like it was cleared of what it needed to be cleared, we focused on rebuilding her gut lining, really supporting that immune system, um, taming inflammation, supporting egg quality. And then I gave her the green light to try to conceive just a month later. And then she was actually able to conceive after just 2 months of trying. And I just met with her this week, 2 days ago. She's now in her second trimester, which is further than she's ever made it before. She has complications. Yeah. And no hormone support this time. She doesn't need it. We do labs all the time. And like, a beautiful textbook pregnancy. Her labs are like absolutely outstanding. Her baby's thriving, a really good heartbeat. The heart rate was like 172, she told me. And she's experiencing some more pregnancy symptoms than in past pregnancies. But of course, it's making her feel more hopeful and connected and empowered by having those symptoms, and a little nausea is definitely okay. And she uses that, as a sign that things are going well, and she's just like super grateful to have that experience. But it just shows the power of functional fertility care and how we address the whole unique person, and how we can, if we give the body what it needs and clear it of what it doesn't and what's no longer serving it, and just calm things down, a lot of really good things can happen from there.
Oh, so beautiful. Thank you for sharing that.
Yeah, of
I
course.
love hearing that. Thank you so much, Macy. This was so great, so chock full of pearls, as I mentioned before. Before we say goodbye, for listeners out there, where can we find you online? Oh, and do you have any? I know you mentioned a practitioner training course, so please tell us a little bit about that too.
Okay. So you can find me online on my website is wellwomennutrition.com. Women is plural with an E. I hang out mostly on Instagram. I share lots of content there. It's just at Well Women Nutrition. I do have a couple courses. The Fueling Your Fertility course is the one I spoke about earlier. This is a self-paced course. It's very customizable, layerable. We talk a lot about the foundations of fertility. So this is great for anyone, anywhere in the space of fertility, whether you're just thinking about trying to conceive or you've been in it for a while. The foundations always matter, right? Because those are the root cause issues. So this walks you through how to heal, how to optimize your overall health, and then again, gain that gift of fertility at the end. I also have a mini detox course because I do focus quite a bit on that in practice. So I have made this to kind of walk through what goes on, what we need to support, what comes first. I even talk about supplements there. So this is a great starting point for anyone looking for more of like a deeper detox or cellular reset.
Perfect. All right. Well, Macy, it's been such a pleasure. You shared so much with us. We've really done a little bit of a deep dive into unexplained causes of infertility. So thank you again. And until next time, wishing us all vibrant health and wellness.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness podcast to discover the latest insights and strategies for optimal health. Join us again next week. And just a reminder, this podcast is for educational and informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guests and hosts are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.